Good evening, good afternoon, and good morning. This is the 1450th day of continuous webinar conducted by International Forum for Promoting Homeopathy. It's a day for celebration. We are about to reach 1,500 day within 50 days from now. So this is the date our countdown has begun. And we have a wonderful young dynamic doctor, Dr. SHEETAL Bidri from Bangalore is joining as the guest of the day. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session in Hindi is already over. But now it begins at 7:30 to 8:30, and from 8:30 to 9:30, the international session in English, and 9:30 to 10:30, a local language session in Malayalam. And all these sessions are going in a good way. And as I mentioned earlier, today is the 1450th day. That means it's a great day for us to celebrate. And today our guest is Dr. SHEETAL Bidri. She has completed her MD in Pediatrics and is the founder and physician at Happy Healing Holistic Homeopathy Clinic, Bangalore. She is a passionate homeopath and a holistic health practitioner. Graduated her BHMS in 2015 and MD in homeopathy in pediatrics in 2018 from Government Homeopathic Medical College Hospital, Bangalore. Inspired by the pursuit of homeopathy at greater heights by learning under various doctors in Bangalore, Pune, Mumbai, and Kolkata. She has been instrumental in editing some of the homeopathy books written by eminent authors in the field of homeopathy and has worked with the eminent doctors, particularly Dr. Sunirmal Sarkar, who handles various forms of cancer through homeopathy and holistic practice. Currently, she practices in Bangalore at Happy Healing, a holistic homeopathy clinic serving the human need locally and all over the globe via online consultation over 10 plus years and passionate as ever learning homeopathy in depth and share experiences and break myths of homeopathy. She has successfully completed 2 sessions of conducting a consistently module for homeopathic students called 7 Days, 7 Remedies, where she encouraged homeopaths to adopt daily reading habits to improve the knowledge and practice well. She is indulged in a good fitness routine of walking, running, or yoga, and inspires many more to do the same by setting an example. She focuses on treating patients in holistic approach, keeping the mind, body, soul, and sin with homeopathy, a good diet, and healthy lifestyle. So to know better about her social activities, you can watch her at her Instagram page, YouTube, LinkedIn, Twitter, Facebook, and all the clinic link also given in the poster. So all these are there, and you can definitely visit her site and see what she is doing. So this means that this young dynamic doctor is going to be a giant in the future. So we hope we can all uh, say best wishes for such a wonderful young dynamic personality here. And she will be talking about acute prescriptions in pediatric is one of the area where homeopathic doctors can do wonders. And we proudly welcome Dr. SHEETAL Bidri to this session. Welcome, doctor.
Thank you so much. Thank you so much for your well wishes and looking for a brighter future for me as well. So thank you so much. I see a wonderful array of lot of doctors here joined in today. Thank you. This forum has been continuous and it goes so well with what I believe in, that is to learn continuously and to be a part of learning on a day-to-day basis. And it's it's a proud thing to be on this platform because you have done an uninterrupted session since so many months, and I wish you all the best for the future as well. So without much ado, should we start the session today? I would like, I do not mind us being a little bit of, interactive through the session, because I know most of us are practitioners here, and it's a end of the day, and we don't want anybody to fall asleep or get bored through the session. So today, let's read a little bit about whatever we know. I'm sure most of y'all are using such whatever I'm going to speak, you will be using all of these in your practice as well. So let's dive deep. Um, what is the basic difference in a pediatric practice? If you may, just slightly unmute yourself and say, what is the main thing that stands out in a pediatric practice, and what is it that we need to focus on? What do you think?
Doctor, we have really we have unmuted all persons.
Oh,
Otherwise,
okay,
there will
okay.
be
No
disturb.
problem, no problem. So you want to just, did you
We
want
can
me
have
to,
10
for
to
the,
15.
okay. All right, all right. So they cannot unmute themselves?
You can they yes, they can type in chat box. That's only.
Okay, cool. So we'll just have an interaction during the chat box. I'll keep my chat box open so that, we could, where's chat box? Yeah. So you can keep talking to me through the chat box so that, I know that you guys are interactive here. Usually I like an interactive session because we can learn more from each other as well. So yes, so let's start off. The main objective, what I would like to run through this particular session is to at least know what are the qualities. Now, I know most of us are seeing pediatric cases, but we're not named homeopathic pediatrician. But yeah, it's okay. So we just want to know how a homeopathic pediatrician should be in the clinic, and what are the main pillars in an acute case. Um, Even if, few pointers, if we find in the case, which is going to lead us to the right remedy. That is what we are trying to address in today's session. And I will share some cases depending on the time we have. I will share some cases that I've seen in my clinic, and try to understand the way I have inculcated utilizing the materia medica, the repertory, and what the patient presents to us in the clinic as well. So I'm trying to put all of them in the case presentation and try to learn a remedy or learn a rubric or the materia medica of the particular remedy as well. So also a little bit about the importance of examination as well through and through the whole session. So today's objectives are these. Hopefully we will be able to run through them through the session. So the first things first is, we know that as a pediatrician, we have to be like an interrogator, a detective, a person who can, find out the intricacies of a particular case, which might not be so prominent, so easily available to us. But yes, we are a little bit like a Sherlock Holmes. Like we have to be a little bit like the veterinary doctor as well, because all we rely on what the parent says and what we see in the clinic as well. So my first thing is that, use the sixth aphorism, what Hahnemann has told, diligently and as unprejudiced as possible, because I know it is difficult to be unprejudiced in this current era, but we could try. We could try to follow what Dr. Hahnemann has advised us. So now, a normal pediatrician would obviously be a good observer, be very friendly, be very warm, not so hurried in nature, and a little bit of jovial in nature as well. So if you are not relaxed yourself, the child is not going to be relaxed. You need the child to be at their own behavior, to their own original individual self. So if you're going to be like, don't touch this, don't do this, don't do that, like, don't come near me, or don't do this, like, if that kind of restrictive behavior is there in the clinic setup, the child might not show its true self. or maybe show the fear part of it, but we will not understand the whole case in detail. So also not to get onto it, like, let them get comfortable, let them feel a little bit more familiar to the place, and then try to ask, then try to examine. Because the moment we jump into an examination, or dekho pakdo, like, take the particular child into your lap, don't be in a hurry to hold or touch the child. Let the child be with the mother. Starting, you can not talk to the patient also, it's all right, because you want that child to observe you, to see what you are trying to do, so that that child is comfortable with you, right? So yes, so the detective part is starts from there, because in homeopathy we know that every child is unique in themselves, and today we will see how unique it can get. I'll try to share some cases which you also can resonate to. We can discuss what we usually see in the clinic as well, and how we could make the best of the information, the little information that we get, and to bring out the best in our prescriptions as well. So, what is the main qualities of homeopathic pediatrician? Like the pediatric practice, when the homeopath is there, it's a completely different ball game. It is a completely yes, we are the same things. We are good observers. We are warm. We are friendly. We are everything, but slightly little better, right? Because we have to have that keen eye, that slight changes on how, let's say, if the mother is talking to the child and the child feels hurt, child feels insulted, the child feels insecure, all of these things, feel the small things that we have to read between the lines, that needs a particular keen eye as well. So how to check the child's sensitivity? The child, let's say the child, again, if I'm telling the child not to do something, will the child cry? Will the child shout at me? Will the child? So each child's reactions gives us a hint about the child's sensitivity. Look for a characteristic symptom. Now, this can be through the mother, through the examination, through your observation, through probably the history given to bystander, or something that a sibling might have come across. So it can be from anywhere. So the characteristic symptom has come from various parts, which I in the practice, it's so nice to see how we could come to a particular remedy. Now, elicit the exciting factors. We know it is so important to see what is it that's causing an illness, repetitive cold, repetitive flu, repetitive abdomen pain. What is it that is causing it, and how the child engages with you, and how they react as well. So these things become far more important as a homeopathic pediatrician than just having a child, because we have to have a third eye, I would say, because we are trying to catch something that is probably very, very subtle, but very, very important. Now, what are these important factors? Let's dive in. If you have any questions, I think we'll address it in the end, but when I'm asking you some questions, you can interact with me in the chat box. I love an interactive session. It is I also get to learn from all of you. Now, what are the main pillars in an acute case? Anybody, what is it that we need to, give most importance to in an acute case, especially in a pediatric case? What would you give? I'm opening my chat box so you can answer there as much as.
And Dr. Bidri, slides are not moving. You have
Now?
just on slides are not moving. It is still on the first slide.
Are you serious? 1 second.
The acute prescription for pediatric practice is still on the ground. Put it in a slide, so then it
It is in the
automatically.
slideshow, sir. What's on the screen right now?
Acute prescription for pediatric practice.
Oh, I've moved forward. I'm so sorry. 1 second.
Yes, main pillars in acute cases.
So these slides were not seen?
No, nobody's seen.
Okay, 1 second. I'm really sorry.
Since
What
you are
can you
talking
see
in a
now?
good way, that's why.
What
Now it
is
is stuck. It is stuck in between. The page 6 and 5 is stuck together. So you just once again start moving. Okay, the pediatrician.
Okay,
Good
so I'll
observer,
just
friendly, warm,
the
hurried.
full screen is not happening. Can
And
you
now
see
it
now?
is full screen. Now it is full screen.
Okay, you're able to see, right? I'm just gonna utilize this only here. I'm really sorry.
No problems. It's all closed.
Okay, so I'll just go through the slides like this then. Okay, so we were
Please I listen.
in the qualities of pediatrician.
Yes.
This is this, you're able to see this, sir?
Yes, the homeopathy pediatrician.
Yeah, okay, you're able to see this one, but you're not able to see in this one, right? Like 1 second. You're not able to see here. Are you able to see here?
Yes, yes. Yes, now you can
So,
move.
next slide is there now?
No, it's stuck again.
Okay, I'm sorry. I'll just do it on this then. I'm really sorry.
Main pillars in acute
Yes.
cases.
Okay. So let's get on to the main pillars of acute case. Sorry for the slight miss here. I'm sure some of the slides were not seen, but it's all right. I think I've narrated it on the screen, and I hope you guys are attentive. So now I want to ask, what are the main things that we as homeopaths see in any acute case, and especially in a pediatric case? You can put it on the chat box, so I'm going to see there. Yes. So Meera Ram says exciting cause, PQRS, ailment factor, activity of the child, child's behavior. Now, you know that, in an acute situation, we have hardly, there will be paucity of symptoms, right? And we don't want to have a complete thermal thirst, exactly. Generals, so physical generals will be skewed, and what the physical generals are in the chronic case can be slightly different in the acute also. There will be slight deviation from the acute as well. So now I'm going to speak what are the things that you cannot miss. uh, these are the things we will take care. The appetite change, the thirst change, the desires change. They might be having cravings that can be something different from usually. Very commonly, I see, in case of high fevers, I see patients with flushed faces and crazy craving for, lemon juice or something sour. Belladonna is something that, helps such children who crave for, sour things or lemon juice or, something citrus. So some cravings come in only during a fever situation, so that can be something that we can observe or ask during the case taking. Yes, so PQRS, generals, thermals, thirst, all of these are very important, but today I will discuss with you something that probably we should not miss in our particular case taking or acute case taking. That is, first thing is observation. So we know that pediatric practice and observation go hand in hand, and we cannot miss. They are the pillars, is a main pillar of our practice, because without observations, without having your own understanding or own look at the child, you cannot make a decision for yourself or for the child itself. So now, what are the observations that, let's go ahead through how we can utilize observations. So now the observations can be what you see in a patient, like somebody in the chat box said, the activity, right? The activity of the child also is so very important. How they are in the clinic and how they might be in the house. So sometimes in my online cases, what happens is I do not get to see the activity, which is so again a challenge in itself. But always, if you have the way of calling your patients to the clinic, having to hold them, examine them, that is the best thing you could do. First thing is that even if you're online, I always say, send me a video of how the child is doing. So photos are different, but video it's something that will help you out in the prescription, because how the child is now. I remember a child who was, with the droopy eyes and, is trying to sleep all the time, wants mother nearby. Now, the mother did not talk to me about the droopiness, the dullness, nothing. And I was giving pulsatilla every other day for the fever to come down. But the moment I went on a video call or understanding how the child is, that droopiness of gelsemium came in so much when I saw the patient, in person, or at least in the video. So that is something that should never be, ignored, because parents sometimes will say that, okay, the child is gone to school, I will come and take the medicine. I said, no, without the child, I will not give the medicine. So you come with the child and take the medicine, because it's far more easier for homeopath. Success rate is far more better if you see the child and observe what it is in front of you, right? So we'll see some observations on what can be done in the clinic perspective, so that you do not miss these particular observation. Some things I will see that, like for example, a child who's looking everywhere. What is this? Who is this? Where are we? Everywhere the child is running around, want to see whatever I keep a hand on, whatever I touch, or they want to go and touch every particular thing. Which can think of sulfur. Sulfur is something where there is touch impelled to, and they're very inquisitive, curious kind of a thing. And they want to go and touch everything to feel if it is real. So they want to have a thing that they go and touch because they want to see if this is real or not. Today I had a patient who came to me and touched my cheek, and to just see if I'm there. Everything in the clinic would be touched. So something which this is seen in the clinic. This you cannot miss at all. So touch things impel to. We have lot many rubrics, but if you get a patient, do not miss sulfur in it. So Sina is there, Merck is there, Thuja is there, but sulfur, with the fact that they're so curious, they're inquisitive about what exactly this is. Is this real? Is this something which I can touch? Is this something which I can play with? We can think of sulfur. Then we have, if a patient is trying to see everything that is going around you, see what that particular everything you touch, your stethoscope, wherever your hand goes, whatever you do, it is constantly looking at you all through the time. And it's very, very watchful, this particular child. So this particular child can be phosphorus, because they are very, very watchful. Watchfulness, and this is the rubric, the watchfulness. Children are look out for every gesture. So every gesture they want to have a eye on. So watchfulness in every movement in the vicinity of the doctor. So wherever the doctor is going, wherever doctor is moving their hands around, then the child will also put the eyes on and very observant. So you can add on with the desire for affection, with the wants to be hugged and wants to be caressed, and the good curly eyelashes. So confirmatory with all other things plus this observation, bingo, you are very, very close to your similum or simile, you can say. So you do not miss certain observations like this. So what are we observing? We can observe the way the child is, the way the child is moving, growing, but also we observe the way they look, right? How they weigh, how tall are they, how the anthropometry is something that is very, very important in the pediatric case taking. That is a head circumference at the right time. So if you are having children from 0 to 1 years, you need to know the growth and development. So observe even that, certain milestones which can also help in the chronic case taking. So today I will talk to you about acute. So now sometimes in acute, when there is where we observe how the build of the child is, can help us in the remedy as well. So today I had a case where the child is growing very tall, has crazy amount of hunger, and has started the glandular development. So it gave me a hint towards towards a remedy, and I prescribed iodine for that particular patient. So observation is something very, very key. So now see if there's any kind of emaciation, obesity. Emaciation where? In the lower part, in the upper part, is the appetite appropriate according to the particular child's emaciation? So if it is ascending, we can think of abrotanum and urgent nitricum. If it is descending, we have many remedies like Lycopodium, Natrimute, Sanicula, Sarsaparilla, which is very, very prominent in the particular in the child. So I have used Natrimute and Lycopodium with descending emaciation, which is very, very marked. So you will see a very thin neck, and they have good appetite. So the rubric being eats well while doesn't put on so well. So there's not hardly nourishment, but the patient is able to eat well in this particular case. Now, observation can be anything, right? So be it, the obesity, we know obese children like calcarea and capsicum are something which is very, very predominant. Capsicum come very close to calcarea. They are lazy as like calcarea. They are very, peevish like cinna. They are very flushed like belladonna, and they look like calcarea. So you can think of capsicum, one of the remedies when you see an obese patient. I use capsicum for fever. One of the patient, he would have, every time he drinks water, he would shudder. So every time he had the thirst, but every time he drank water, he would shudder. He was very whiny, wanted to just be by himself. Capsicum came out so good, which is not, calcarea was not helping in that particular child. So I would think of capsicum as well. So don't miss out on similar remedies which can help you out. So antim crude as well. So the ailments factor, what caused their particular situation, that also becomes very important. Now, observation is the key in the pediatric practice, no doubt. So we observe, observe, observe. Every single detail you observe, even if it is how they're reacting to the parents. Very commonly, if every time I ask a child a question, and the moment I'm asking the child here, and the child will look at the mother and be like, okay, then yes or no. Then again, the child will look at the mother and say yes or no. What would you think of? What remedy comes into your mind? Are you there? Are you there? Everybody is there. Only Dr. Aishwarya is there.
Yes.
Only Dr. Aishwarya. Oppo F5. Yes. Meera Ram. Yes, so Aishwarya and Meera, right? Pulsatilla is the remedy, right? So Pulsatilla is a remedy who answers in single words, only yes or no. Silisha can only do only nodding. Every time looking at the mother, every time looking at the Pulsatilla. So we can think of Pulsatilla that you cannot miss it, right? The types of cry. All these become very, very confirmatory to your particular remedy. You can surely give that remedy in the potency the child requires. You will you will get the result in the lowest amount of time. So importance of examination is something I want to also put in observation only, because this also comes in observation. So minor details. Now I'll tell you about this person, this case, who I'm treating for recurrent cold cough. He's doing pretty well, but what do you see in this particular photo? If you can see, what are your observations? I will zoom in further. Can you see? Tell me your observations. Where is the chat box? Everybody can see the screen? My chat box is open, so you can start putting in. Yes, there is decay, there's decayed teeth, caries, serrated teeth. Very good, Dr. Sandeep. Yes, Dr. Faizan. Premature decay. Yes, Dr. Aisha. Yes, Dr. Ashmat. So there is serrated teeth, so very peculiar serrated teeth and decay. Now, also you can see the decay is diffused, like somewhere there is in the near the root, somewhere during on the sides. So the complete mix. And also if you see the teeth are crowding on the other side, they're not growing in the correct manner. And this child has not had his tooth fallen at all in a very after his his milk teeth are still not falling. He's almost 7-8 years old. So Now, this same child, of course, the rubric here I wanted to think is serrated teeth. Syphilinum, sorinum, tuberculinum, basilinum, all these nosodes have a tendency to have serrated teeth, which have this tiny serrations between the teeth, and they work so beautifully as intercurrent in remedies when you're giving for acute. So even so, if you can see in this rubric, you will see nosodes that go through and through. That is syphilinum, sorinum, tuberculinum, medorinum. So these remedies work very well as indicated remedy or intercurrent for your remedy, so that the recurrency of the symptoms start becoming less for these particular children. So now the same patient, interestingly, I did not stop just there. We saw the tongue. What is the observation in the tongue? I shall zoom in further. What is the observation in the tongue? Perfect, cracked, yes. And white coated fissured, posterior tongue coated white, yes. Thick coating white fissured. So now the interesting part is it is cracked. Exactly, Dr. Raman just said this deep crack, and Dr. Shailaja also is telling me this deep cracked and white coated, and there's a central streak. The crack is only in the center, right? And this is something I've not seen in this child. This child has come first. There is coating whenever the child is lazy to there is coating, no doubt, but the crack is something that was new for this. So yes, the rubrics can be thick, coated tongue. What are the remedies that give you crack in the midline? Exactly. So everybody's awake. I'm glad. So, there's an observation where cannot miss remedies like Nux vomica, Antrim crude, Kali mure. All these remedies will never be missed in case. Nitric acid, because you will not miss it if you have, if you have examined that particular patient. And this will happen only if the child is calm, right? Now, if I ask the patient's mother, how is the child's tongue? They would never think of looking at the child's tongue unless they have been visiting a homeopath regularly. They will never know what the child's tongue was. Now, my online patients are trained in a way that they'll send me the tongue picture first, and then they'll get on a call with me. So that is very important, the examination of tongue. So we can think of root, base, tongue is white in the mouth chapter. So we can not miss all these remedies, right? So this is from a complete repertory. That is glonine, natrimure, antimcrude, laccananum, nux vomica, rus veneta, kali brome, kali mure, medorinum. So see again medorinum, right? So now again, the crack in the center, correct? We again have another rubric. So if we put all these remedies together, we can get the indicated remedy like this, right? So now putting this this particular child in observation, this child surprised me further, because what can you see in the next picture? I want you to observe keenly and tell me what is there in this next picture. Look as clear as possible. What is there in the picture? Adenoids cannot be seen through the oral examination. You will need a PNS. I will zoom in further. What can you see in this picture? This is the uvula bifurcated, GHDT, whoever that is. That's the right answer. So there is a bifurcated uvula in this particular patient, which was the first time I saw in my practice. If anybody has seen this, please let me know. And I want you to find out that, if this where this particular is rubric or materia medica, where can you find bifurcated uvula in the medical materia medica or repertory reference books, wherever you can. Please let me know, because I sat 2 days sitting for it. You can let me know. You can message me on my email or my Instagram and tell me where you found this bifurcated or bifid uvula. This is the most I can make him open his mouth. But yeah, this was something which is new and which is very interesting as an observation, which was something new for me. Now, this you will get only if you observe and get examination. So now, one of my online case I want to share, that is it's a case of cerebral palsy, actually. Now, the child is quite grown. She is doing well, but sometimes she has acute bouts of, different ailments, which she uses homeopathy for. Now, whenever the child is awake, she's always crying. She's always crying, screaming, howling, and, constantly clenching the teeth. The only time she's not stopping to cry is by chewing on a cloth. So once the mother is giving, of course, this child cannot speak, cannot tell anything, cannot do anything. Child can only, cry, moan, smile. That's about it. It's a cerebral palsy patient. Now, the acute here was, the suddenness of the crying, the elaborate crying, the howling. The parents were, worried for the child. So this became something which was very important for me. And I thought that what is it that, gives her relief? I try to give her, what remedies come to your mind in case of, coming, carpophagia or something, what we say, putting the clothes in the mouth, right? So here it is a soothing factor for the child, right? Now, we know that she's got brain complaints. She has, her brain is not in the the best brightest way, but the only thing we can that's one of the things we can see right now is this particular video. This was again on a video call where I asked what is it that she's chewing on. Now, if you ask, you will get. If you find, you will find another answer as well, right? So the answer to it, what remedy can you think of that the child is stopping to cry when there's something chewed on? What can you think of? Belladonna. Mm-hmm. What else? Stramonium, calcarea carb. Now, is this observation important? You tell me that. Like, is this important? If I have told that, then it is important, I think. What? Yes, Sina. More remedies coming through. Yes. More remedies coming through. Yes, only Sina. So now I was very curious. Now, what is the curiosity, Camomilla? So we could give all these things for her to calm down. And honestly, I for her acute gelsemium helps, opium helps, and this girl always has gelsemium with the mother. Always has gelsemium in acute situation because she gets droopy. Even in this, her eyes are very droopy to look at as well. So I've not got this thing to share. So I am sharing only this much. Now, what I found in the repertory was so beautiful. Like, I just found a particular rubric called Face Chewing Motion of Jaw Brain Complaints in. Right? So this is, of course, is not a video. I've taken a photo, but constantly chewing. And Helleborus, how, droopy, drowsy, eyes sunken, eyes are, tired. Now, I gave Helleborus, okay, Helleborus in 1 m. And the child, I forgot to put the follow-up of the mother's WhatsApp chat. She was like, amazingly with Helleborus, 3-4 doses, the child broke out of this whininess, cryingness, and the weeping episode just broke out. Her droopiness also got better. She went into sleep. Sleep is always a good sign. So the child slept well. And then, she woke up without having to experience this whole howling and crying and causelessly crying situation. So that was something which was on the basis of getting an observation, taking help of repertory, and reading that same thing in materia medica and applying it in the practice. So now, once you apply, for me the circle is complete after sharing with all of you all here, because once this sharing is done, even others can also utilize it, because such things are common to see in the cases, but we always fail to look for what can be always there. So now that you're aware of that chewing motion in somebody with brain complaints, you will not forget bryonia and hydroborus. So depending on the child's presentation, you can always get through these remedies, right? So this is one case I wanted to share. Are we all good? Are we all good with the observation? Yes, so you're awake. And yes. So a few more important factors in the acute case taking is the next one is immunization. So immunization, most of our parents are going to immunize, are going to land up in bad effects, good effects, whatever it is. We have wonderful remedies. Today I want to tell you one remedy which I have not mentioned. I don't think it's mentioned here, but I want to mention this here. Ill effects of vaccination, never forget melandrinum. Melandrinum is something that helps in patients who have GDD, that is global developmental delay. The speech is delayed. They're not able to, develop according to the milestones. Another very good remedy is not mentioned here, but it is Torula. Torula is something which I learned from Dr. Sarkar, and works beautiful, because any bad effects of Torula vaccination, Torula always helps, however long it might be. You can take the help of Thuja and Torula and Melandrinum, Stylisha, depending on that. And if the child is having mostly respiratory complaints, think of Antim Tart as the, for the ill effects of vaccination. Again, asking again, only if you ask this particular history, you will get to know. And we have many in the repertory, you'll find many remedies, but always add into the what the child is presenting with, what is predominant, and then you decide on what remedy to give, right? Are you able to hear me? Somebody said there's no voice.
Yes. Everything fine.
Yes. So moving on, after immunization, the most important thing is ailments from. Always ask the exciting cause. Somebody rightly said the initial factor, only the exciting cause is very important in a pediatric case. Now, most often than not, it is so difficult to find out what caused them. Like, you will, the key to asking how the ailments from is persistence. You have to sit there and ask the patient's mother what happened, why. From 10 days they are having this cold cough. What happened 10 days back? What did the child eat? What was different? The best thing to ask is what was different. What was different from the routine? That's it. And you might get something out of the parent, right? Now, I'll give you a hint, which was a learning curve for me as well. There was a small child who started off eating meat way earlier, around 6 months and 7 months, at 7 or 8 months, if I'm not wrong. And then he landed up in gastric disturbances and constipation. Now, what would you think of the remedy? Antimproved, very good. On the basis of, as simple as having meat, pulsatilla, nux vomica, pulsatilla. Yes, I love the chat box. I'm glad that you guys are answering. Carbo veg. Now, for me, I would have given, subconsciously giving all of these remedies, right? But Nux vomica, yes, Dr. Jyoti. So these remedies would be crucial. Now, how did I get to that particular remedy? By asking, right? What happened? What happened? What happened? Now, no mother will tell you, he's eating normally, he's eating this thing, but we know that eating meat little earlier than the usual is something which is not advisable for young children. We usually start from the yolk of the egg, then slowly we'll go to the protein, and then slowly we'll move to meat. So this particular child, since it started way too early, uh, I wanted to see what we could get in the materia medica, because without understanding what is given in the books, if it is really going to help this patient, because what we want is result, and if that result is not given, the parent is not going to be happy, and you are also not going to be happy. So you want job satisfaction. So I also want to give you satisfaction for attending this particular webinar. So what I looked for was in nurse repertory. Can you see this particular rubric in nurse repertory? There is a rubric under the pregnancy chapter in infants causing constipation who are active, irritable, and those who have been prematurely fed on meat. Very rightly written, something which will come only after history, only after digging from the patient's mother. You have to ask them, you have to keep on telling that, kya hua, what happened, kyun, Indaji, whatever it is, just ask. Only if you ask is you will get the remedy. So this came out through and through. What are the other ailments from? Like, what are the usual things we see in the case? We will see things which have change in weather, change in change in weather, something we can ask by ourselves, because when the weather changes, people are coming, it is because of change in weather. Yes, we ask them and we can get to know. But some things are something like this will come only after repeatedly asking history understanding, right? Now, coming to another very this thing, changes in basic changes in diet. That also was something which was from one errors in diet was something was given in nurse repertory, which also came through and through in that particular right. So eruption, rash caused by heat or errors in diet, isn't this common? Usually I give pulsatilla. I would end up giving pulsatilla because very urticaria or eruption or a rash after eating something which was not suiting that particular child, pulsatilla helps really well. But chamomilla, who would have thought? And with chamomilla, this rash can be taken care of when we know that there is a slight change in the diet. And this can be seen because in infants, we will know. We will know if there is a slight change in the diet or not, right? So it's very easy to find out if the child has a different diet, if something is new, because we, in the case taking of chronic performa, if we want to do chronic someday, we can do it. Nutrition is one of the key features. So I would ask each of a parent, what are the feeds? How many feeds were taken? What is it what they're introducing? What is the weaning process taken? Are you taking purees? What purees are doing? Fruit puree, vegetable puree, rice and dal. What are you doing? So each smallest of change in the diet, and if the child is landing up in a rash, don't always think of pulsatilla, but also think of chamomilla. Chamomilla can help you, and also mood-wise, everything the child can feel far, far, far better. Right? So this is given in nurse repertory again. It is in infants chapter. So in nurse repertory, Angel, the error in diet during pregnancy causing rash in child, no. Errors in child, error in the diet for the child. Now, infants chapter, infants rubric for the children, no, it's given under the chapter of pregnancy. Under pregnancy, we have the infants chapter. In that infants chapter, we are seeing this particular rubric. I will show you you can just go through the nurse repertory, you will understand what is the this is just a sub-chapter within the pregnancy chapter. Clear? What are the common other ailments from that we will usually see in the clinic? Is everybody there? Mother suffering from infection, yes. Change of climate, very common, yes. Dentition, very, very rightly said. Dentition is something we do not miss. What the problem can be, so I was just trying to share my screen. Somebody had asked me. Ailments after punishment. How do we take that? How do we take that in the understanding of the uh, uh, school opening? Very true. Right? Then what else is there? Other child is ill. So can you see my screen now? If you
Yes.
yes, so in nurse repertory, if you go to a pregnancy chapter, in that pregnancy chapter, you will find infants. So whatever the children require, we can go to the infants chapter and understand. Now, for example, if there is dentition, that is giving a cross reference. So what I was trying to, okay, it's going directly to the dentition chapter, which is coming in the this thing. Okay, so this infants chapter, if you read in detail, no, in the nurse repertory, you will learn so many remedies that are so beautiful, and you can utilize all of them in your practice. So this is the chapter what I found out. See here, constipation. If you can see the constipation rubric, we will find the common remedies there. But peculiarly, what we needed in that particular child, like the prematurely fed meat, or dentition during dentition, they have constipation. We can have magmure here, right? So stools are hard in lumps. They can think of antimproved. And when there is um, desire with apparent frequent with effort to stool caused by stimulating food taken by the mother or nurse, right? So nux vomica, I use this. We know that stimulants aggravate nux vomica, right? But have you applied it like this? When I remember taking for a particular child who mother started having coffee after she had taken a break from the pregnancy, and then again during lactation, and the child was 7 to 8 months old, and the child ended up in constipation because the mother had a little bit of coffee and tea. And Nux vomica helped this child to relieve. This child had not passed stool for 4 days. No stool, nothing, even on pressure, everything. The child had not passed stool. Nux vomica helped the child to pass stool. Only one pill of the Nux vomica, and given only once. The next morning, the child given at night, and the next morning the child had passed the stools. So you can utilize this particular this. Please share aggression of autism cases, which is a very big chapter in itself. We can do it sometime, no worries. But I wanted to show you this particular, repertory in itself to understand various parts of case taking. Case taking becomes very easy if you read a little bit of it.
Dr. Sheetal Bidri, it's
Yes.
only just 5 minutes remaining, so we have to control
Okay, so we can do probably part 2 of it, but we can do for today. We will conclude at main pillars, that is observation, immunization, and ailments from. The part 2 of it, that is the common complaints and the cases. If you want, we can do it some other time. I had probably over prepared. Okay.
Yes, definitely, we can have the second session in the September. It's
Sure.
second week as for your convenience. Okay.
Sure. If you need me there, I will do it. So if you have any queries, we can take it up. I had prepared some cases as well, but I think the time,
Yes.
I am very slow.
Yeah, no problem. No need of going in a hurry. But anyway, your presentation was superb, I must say. It's really show the beauty of homeopathy and how a homeopath need to look into different aspects of child, no, pediatric cases. And as everybody know that we used to take symptoms one by one, but the more important thing or the most important thing is to observe the patient, what the patient is doing in front of you and what how he come to the clinic and how what are the things the patient used to suck, whether it is taking milk or not. Even sometimes you may find that the child is mother is telling that doctor, I am the child is just born just 3 days or 2 days back, but still it is not able to suck the milk. But when you inquire
Yeah,
about further, you can find that the nipple is too short. Then how?
yeah,
So these are the things you need to question into the mother also, to the family members also. Then only we will get that clear picture of the disease problem. And as you point out rightly, the symptoms need to be correlated with the repertory or material medical so that you can make sure that what the medicine you are giving is absolutely 100% right. And when you give a medicine 100% right, then that will work with a single dose. And that's the beauty of homeopathy. Anyway, congratulations. Those who want to participate in the discussion, you can raise your hand in only just 2 minutes remaining. Anyway, we will have one more session. Dr. Ramadevi Ambadi, please come up. She's one of the.
thank you so much. Thank you so much for this opportunity, and I really liked the audio. I mean, participants to interacted, and thank you
Yes,
so much for Dr. Rafiq. Also, I want to mention this because he has been encouraging and helping me to he- pushing me to come forward and do the session.
yes,
I would especially want to thank Dr. Rafiq.
yes,
Yes.
definitely.
Can you hear me?
Yes, yes, madam.
Yes, very nice section. I had told when you are asked what's the difference, that's the thing we are not getting when we are seeing the this case. I had told there is no subjective symptoms. We will get only objective symptoms from the children, isn't it? So we should be observing very keenly, isn't it, doctor?
Thank you, ma'am. Thank you.
Now, very nice section. Thank you a lot. You should come again and again.
Yes, sir. Ramprasad sir, please say in 2 minutes, just 1 minute.
Thank you, Dr. Sheetal Madam. Excellent session. Very nice presentation.
Thank you so much, sir.
Acute prescription. Very, very thanks. Thank you.
Thank you, Dr. Dhanesh, for following up with me and getting this presentation here. Thank you very much.
Anyway, it's really a very good day to celebrate. That's why we really celebrated the session because even as you know, the child is the father of everything, and that is what we began the session in such a beautiful way. And we can go ahead with some more presentation. That means that you are also growing in such a you are going to achieve something great in the future because that which content is there with you and your knowledge is excellent. Your hard-working personality. That means just 10 years you are doing a lot of wonders. That means that you will achieve what you need to be.
It's all your place. All the best. Thank you so much, sir. Thank you. Thank you so much.
Thank you, Dr. Sheetal Bidri, and those who participate in the session also. Tomorrow we will have a session from Dr. Rudresh, and he's one of the senior doctors from Bangalore also. Yes, so please join in time. So with that, we come to the end of the day, 1450. Thank you all. Good night.
Thank you.
Thank you. Good night,
Thank you.
everybody. Thank you
Good
for
night.
joining.
Very, very thanks.
It's over to Dr. Mariamma John to moderate the Malayalam session.